Hello, thank you everyone for joining. My name is Sam Tennant. I'll be talking you through this demonstration today. I also have a couple of members from the team here to help field any questions and provide further context when needed. So if there are any questions that you want to go through, please put them in the chat so we can go over them at the end. Like I just mentioned, I'll be recording this demonstration and sending it out to all of you afterwards with some follow-up information. I apologize in advance for any crazy noises you may hear my dog make, but that's the world we live in right now. So let's go ahead and get started. So the goals and agenda for today are going to be you'll learn how to access the map room and community needs assessment tools on SparkMap. I'll show you how to access the map room data list and make a simple map. I'll also show you how to access and generate a community needs assessment report. And then because this is a COVID-19 specific topic, I'll primarily be using COVID-19 data for this demonstration, as well as going through some of our COVID specific tools we have built within this last year. So I'm going to go ahead and turn my camera off and keep on rolling. So this is the front page of SparkMap. And before diving in, I kind of wanted to set some context for you all to who we are. So SparkMap is a product of the Center for Applied Research and Engagement Systems, otherwise known as CARES, and it is hosted by the University of Missouri. CARES does have a master website that I'll drop in the chat called careshq.org. From there, you can learn more about other ways of working with CARES on a more custom level for your data needs. But for over the last 25 years, our team has supported initiatives across healthcare, nonprofit, government, business, and agriculture industries. SparkMap essentially aims to make data as easily accessible as possible. As we've been working in this space, we recognize data is everywhere and it's going to keep churning out. So oftentimes we found ourselves wishing all of it could sort of be in one place and organized so we wouldn't have to spend a lot of time jumping from site to site. Also, being hosted by a research institution, we were always jumping to multiple sources for our projects across campuses, or helping other researchers with their projects. And so we started running into similar problems. And really the culmination of creating SparkMap really was the idea of making sure it has all the data you need all in one place, which is always going to be our logo here at the very front. And so what I wanted to do first was log into my account. And something I did want to point out is clicking on this login button over here on the top right, you'll see we are redirected to the University of Missouri extension. It's automatically noticing me, but it will redirect you to the University of Missouri extension site. So hopefully that makes a little bit more sense given the context of our MU affiliation. Anyone can create a free account from here and begin making and saving data visualizations. You've probably noticed we have a few subscription option levels that all offer various access. The subscriptions allow for us to maintain the data consistently and also always be on the lookout for new data to add. So from here, now that I'm logged in, I'm actually logged in at a premium subscription to give you a better look of how the tools work. So please take what I show you today, make a free account and get playing on the site. And so you'll notice now that I'm logged in, kind of my menu has changed up here in the corner. And more specifically, I have now a user dashboard. These are also included for free logins. So please come in, make one and see what the dashboard is all about. So on the very front here, we just have a few things to help you get started. These starter maps and assessments are preloaded with data to give you a running start. We've just picked geographies already. It looks like this is Louisiana and we have Michigan. You can always hop in there and change the location and sort of get playing in wherever you're located. And then on the left-hand side, you can see I have my projects, my data and locations. So as you use the tools, you'll notice different save button opportunities. So anytime you save a project or a location, here is where you'll end up finding them. So if I click on my data and locations, here's just a handful of the different layers I've uploaded personally for projects, or some of the locations I've created in assessments using, custom geographies that I didn't want to have to build again, like 13 census tracts, for instance. I could save that location and come in with a running start from here. And so additionally, on the top right, we have here a create button, or that same button is going to be over here on the left. And this is really where we get started creating something. So from here, I can make a new map. and a new assessment. And depending on your subscription level, you can also make a fresh data upload or data build. So if your organizations also collect your own data sets and there is addresses or geographies attached to them, you can upload them through a number of different file types and physically see them on a map yourself. But I'm going to go ahead and start with a community health needs assessment. And so as you can see, now that this page has loaded, our chna process is a really simple 1, 2, 3 process. It's a pick your location, select the data you want to see, and then what report output are you going to want to look at as well. So the first things first is selecting from the county list. But because I am logged in at a different level, I have a few more options for selecting locations. For instance, I can select multiple counties within Alabama from here to do a report on, and I can remove these at any time. Or for instance, I have a situation where I can use the draw my area. So I noticed a lot of folks on this call are from New Jersey. So I'm probably going to pick on New Jersey quite a bit today. And from here, say you have a specific neighborhood you want to look at, a lot, a field, or a hospital zone. You can come in and sort of create your own custom layer from here and get a needs assessment created out of this, whatever is within the radius you drew. And then additionally from map, almost a similar situation, but you'll actually specifically select different geographic types. So if the data can go closer than a county level, like a zip code, a census tract, or school district, we'll offer that. So for instance, I can hit zip code and kind of zoom in closer and pick a custom selection of zip codes from the map to start doing a report on. So they can literally be next to each other. They can be completely across the state. The options are up to you. And so from here, I could create a data assessment off of these 4 zip codes if I truly wanted to. But I'm going to kind of go the traditional route today. And once again, I'm going to pick on New Jersey and select just the first 3 counties here at the top. So now that I'm ready from step 1, I'm going to either click this number 2, or you can hit data indicators down here in the bottom. So currently within our system, we have about 250 plus data indicators that we've tried to put into these separate categories. So for instance, under demographics, I have all of our population information broken out, all the different types of urban and rural population or veteran. And then as you can see, as I hover over them, this I button starts to come to life, and I can see this means see more info. So if I wanted to know more about a specific indicator, I can find out the data attributes, what else is going to be included, that supplemental data. Well, you'll notice at SparkMap, anytime we can create a map out of something, we will. And so they're left and right. Always click on this view larger map if you want to see this specific layer in the map room. And then you can get some more information on the data source itself. And so because this is specific to COVID-19, I'm going to hop down to the bottom and go to our special topics, COVID-19. But because many of the environment and the health behaviors and outcomes are closely related to that topic, I do recommend coming into the assessment, kind of looking at what else we have that you might want to compare to, or whatever you're trying to collect data on, whether it be prevention, different insurance or health behaviors like alcohol expenditures, tobacco uses, things like that. By clicking the box on the topic itself, it has me select everything. And then to show just a couple other technologies within the assessment, I'm going to click a few of the demographics. And then I'm ready to hop over to step 3, which is the actual report itself. So as this gets loaded, you can see I can hop back to 1 and 2 at any time if I wanted to change my location, see a different set of indicators, and go from there. Like I might actually end up removing just one of those, a few of those population ones, because they take a minute to load. So as this is getting ready to, here we go. We can see we have our title for our community health needs assessment, the 3 locations I picked, Atlantic County, Bergen, and Burlington County, New Jersey. And then as well as it'll go in order of those categories of the indicators. So demographics was on top. and then we start diving into the data itself. So every data indicator will start with the title. So this is total population. We'll provide a stem sentence, which basically summarizes what you're looking at here in sort of an easy to read format. And then we'll provide the data table. So for instance, we have our areas we selected, the actual data values for population, and then the land area and population density. At the top is this report location, and this value is going to be the sum of all the areas you picked. So the 3 counties I selected were then added together for a total report location. But we do also provide the individual counties themselves. And then we'll also put in the state and the United States. So you can kind of benchmark, depending on the indicator, kind of how you're doing or where you sit from there. And so I can always hit this hamburger menu down here in the bottom right if I wanted to jump to a very specific layer. So for instance, here's COVID-19 confirmed cases for those 3 counties. Like I mentioned before, here's that stem sentence, our table, and then anytime we can provide additional data visualizations, we will. So for instance, over here on the right, we have what we call a dial. And what this is saying is it'll either be red or green, indicating green doing better than the state, or red, your county is not doing as well as the rest of the state. This might be something we want to look into. And so for instance, the report location is about 11,000 total confirmed cases together, but because New Jersey has a higher value than that, it indicates a green dial. And so, like I mentioned before, anytime you want to find more of this data in the map, you can click this view larger map and it'll take you straight into our map room. If you wanted to know even more details about what this layer is, sort of the methodology, most of the time we'll also have a source going back to where it came from. You can download from there. But I always like to know what exactly I'm reporting on, especially if it's going to bring on a new program or create some change within an organization. And so like I mentioned before, anytime we can do trends over time, we've been tracking data for like 25 plus years. So a lot of our indicators go back pretty far. Because this is a newer topic, we have been collecting since day one, but I believe this is starting with weeks. But then you can kind of start to see your trends for New Jersey, the report location. And because this is collecting for those 3 counties, if you wanted to just see one, I would just scroll back to the top and remove those 2 other counties I'm not interested in seeing. And then this data table would change to then just viewing the 1 report location I want to see. So anytime, like I said, we can provide more visualizations, we will, some trends over time. And I believe I'm going to hop back up to the top and show you a little bit more about what you can do from here. We always want you to be able to download this. So you can download this as a PDF if you wanted to share this with your organization or provide handouts at any presentations. If anyone on your team is interested in going further with more analysis, or your organization uses something like Tableau, for instance, you can download this as an Excel table and get that raw data, and you can kind of do a little bit more on your own time if you wanted to compare with your organization. And then Microsoft Word. I like to do Microsoft Word if I'm going to pull any of those graphics like that dial or the tables. It's nice, I can just copy right from there. We do have a number of report options. So say you're going to print this out, and like me, I'm always running low on color ink, and you don't want those maps to show up and kind of take up a lot of space. You can remove the maps. You can remove that state and county benchmark if you didn't need that either. It's sort of up to you what you'd like the output to be like. A feature one of our clients referred to us was they mentioned they would love to get this report for specific zip codes. And so at any time, we're always asking for feedback of, when you're making these assessments and you think, I really wish it could do X, Y, Z, always let us know, and we're interested in creating it. And so we also made this zip code data feature. So if I click that, any of our indicators that will go down to that level, I now have every zip code within our 3 New Jersey counties with their legitimate data inputs for each zip code from there. So now you have an even closer report than you had to begin with, and a little bit more to play with. And not every indicator can go that far, but it is nice for the ones that can. And then like I mentioned before with that green dial, that indicator was sort of staying like, wow, in this indicator, you're doing better than the state. We've also created an output where you could pull a report that just has every indicator that is doing better. So you can also report metrics of your success. If you've created a program and you're looking for legitimate change and you can track that from years ago, this is always great to, congratulate on successes. And then we also have an indicators worse than the state average because none of the indicators I picked that option went away. But say, for instance, you selected everything and then you wanted a report of everything that you're doing worse than the state average, that also kind of gives you a running start for some ideas. If you are not interested in having everything and just sort of want a quick facts, just give me the data in a table. I kind of like doing these. It really shortens them up. And then if you're doing any sort of citation for any studies, we've done a lot of that work for you in our source and methodology. You can always share this information by copying and pasting, social media, email if you're interested, printing, and then there's one of those save buttons I mentioned earlier. So I recommend always save this specific report that you've made, and you can go into your dashboard and go from there. Something I did want to share, given the topic of COVID-19, is we do have a COVID-19 resources page under resources. And there is a COVID vulnerability assessment. So this assessment is literally that same report as before, but very specific to what we recognized early on people were tracking to look for indicators around COVID. And what's nice about this is for those of you that don't have subscriptions already, you've probably noticed if you've played around on the free side that some indicators are locked. And what's great about this is some of these are locked specifically on the report side of things, but because of this vulnerability assessment, we've given access because we want you to be able to make these assessments because this was happening to all of us at the same time. So always poke around on the site. You might kind of find a few places you have access to things you might not have before. So for instance, I can just select everything under this vulnerability assessment, and I have different things like all the cases, different populations, other things we're looking at like broadband access, employment by job sector, mobility reports, unemployment, and then really early on, it was important to see what the hospital bed capacities were. And so we created those within a report, and it works the exact same way as I just showed you. So like I said, please come in and create one from there. I know that was a lot right out the gate, so please note some questions and I can get to them towards the end, but I am going to hop over to the map room and show you how to create a map from there. And so this is a piece at SparkMap we're really excited about, and most of this is for free to use at any time. This map room itself, it contains over 30,000 different mapping layers there's just infinite possibilities of things you can look into that you may have never even cared to see before. But for instance, you can enter a search word and all the results will pull up, or you can browse by topic or source. So if you're ever curious, like just looking at health, you can kind of go in and dive deeper into these carrots over here on the left and drop down, and then you'll get down to those individual data layers. Additionally, I can browse by source. So if you're ever curious what we're up to, where we're looking, here's all of our data sources we get all this information from, like the American Community Survey, the Behavioral Risk Factor Surveillance System, or recently we just put in a lot of really great new data from county health rankings. And these drop downs work the same way as I just showed you. So if you wanted to come in and get closer, it looks like here's some juvenile arrest rate. And then just like before, that I button, I can find some more information about the description of what this layer even is, when the release date was, the cycle, the data source, and then the data source subscription if you want to know more about who the county health rankings are. But kind of what Google has conditioned us to do is search by keyword. So we have this big search window, and I highly suggest just typing in one word at a time. So for instance, if you are interested in small business, I would recommend just typing in the word business. So I'm going to go ahead and just type in COVID, and we have about 11 different results from there. And you can kind of decide from there what exactly it is you're wanting to see. and then make your selection off of that. I'm going to go ahead and just pick this COVID-19 cases in the last 14 days from the New York Times this year. And all I have to do is add to map. So now you can see I have a color loaded on the United States, and now it's time to have some fun and play around. And so on the right-hand side is my legend. I have the indicator I'm looking at, what the actual values are between these colors I'm seeing. If we can change geographies to get closer, we will. Looks like this just does state and county. And then sometimes we'll even change the data type. So right now, this is just looking at the percent of total cases in the last 14 days. If you wanted to specifically see the totals, you can do that. Or if you're interested in percent change from 15 to 28 days ago to do some further analysis, you can. But I'm going to go ahead and just leave it at that. There's a few ways to navigate over here on the left. I can either click and drag my screen using my mouse. We have some arrows. You can get in, zoom in closer and closer and closer if you'd really like to from there. And then we also have a bunch of fun base maps. Right now, there's just sort of a classic map up, but if, for instance, you want to see some specific satellite imagery and get in closer to like a hospital region, and you've noticed some data is kind of funky, I always like to zoom in and just see what's going on. Sometimes you'll find out, oh, it's a big lake. That's why there's no data there, kind of things like that to help you going. And I was able to remove that color by clicking the checkbox up here in the top left. That removed my actual data layer itself from the legend. And so I'm going to go ahead and just kind of click back to a original base map and then zoom into an area using this search bar up in the left. And like I said before, I'm going to pick on New Jersey a bunch today. And now you can see I have county level data for the new cases in the last 14 days. So what do I do from here? There's a number of things, and you're not limited to one data layer. So what I want to do is add something else. So if you're ever interested in the relationship to things, or you're just curious about correlations, for instance, I could type in something like poverty, and I get about 398 different results on poverty, much more than that 11. And I'm going to look at this population below the poverty level, ACS 2015 to 19, and add that to the map. And as you can see, now blue has popped up, kind of taking over. And over here on the legend, I can click on my actual map layer itself. And whatever is at the top is what's going to take precedence in color. So if I move blue back, that's what's happening there. And so, it's hard to be able to see this red and orange over this blue. So there's a couple of functions you can do from here to kind of get in closer. For instance, I can hit label, and each of those counties will then be filled with the percentage of poverty. And then what's great too is I have this transparency bar where I can make it extra dark, or I can make that disappear. So now I'm seeing my COVID-19 cases with the percentage of poverty. Now this is a stretch, but for instance, say within your programs and your projects, you're looking for specific correlations, like I said before. This is one way to come in and find some weird anomalies. Like this, specific county down here in the corner has a higher population below the poverty level, but the new cases are about the same. Is there any relationship there? You can always click on the map and find some more metadata from the actual county itself. So now I know what my total population poverty is, what the total population is, the margin of error, and different interesting things like that. Or you can do the opposite. So for instance, I can change this data geography to something even closer, like I mentioned before. So if you're ever interested in getting to the census tract or House or Senate districts or school districts or zip codes, we've usually had those in place. So I'm going to go ahead and do the opposite. I'm going to turn my label on for my COVID-19 cases, turn my transparency off, and then I want to see what's going on within the census tracts. So it looks like about across the state, there's about 0.5 or 0.25 in between of cases in the last 14 days, which is great. But then you can kind of start looking over the different poverty levels to see if there's any relationship there. Like I mentioned before, that's a stretch. That's just the layer I decided to pick for this presentation, but something you can do to get in further. And then additionally, we have a number of tools within this, within the map itself. So I can click on tools up here on the right-hand side. And there's a lot of fun extra things I can do. Like I can query the data. For instance, this is essentially asking a question within the data itself. So if I wanted to know within the population and poverty, all of the areas that are greater than 40%, I can run a query. And now all these red areas that popped up, not a lot in New Jersey. Looks like Philadelphia had most come up. I'll peek at this one though. Yeah, this one had about 50% population below poverty. And what's great is, 104 results popped up, and then I can show the attributes. So now I have everything within the area I was looking for that has a greater than 40% population below poverty. And then you can download this for further analysis or just visually see what's going on. I'm going to go ahead and exit out of this query, and same for the select data. So for instance, say you're specifically looking at a neighborhood or you're a hospital system and you want to know the vulnerability populations within a 10-mile radius of your location or your school. You can also do that and show the attributes and go from there. That way you're getting in even closer to the area you want to see. Or if you wanted to look at a specific rectangle of an area, like that's popular with our agriculture clients looking at farmland. You can pull up a specific area and show the attributes from there. We do also have a number of fun things you can do on the map itself. You can measure location coordinates, path lengths, and shape areas. We just had a client recently kind of map out their town and how far bus stops were to farmers markets or convenience stores, and they did a really cool study on kind of the distance between that, how long it takes to end up getting food, and they used that measure tool. You can draw graphics. So for instance, if you found something you want to show in a presentation, but no one's going to look at it the way you did, draw an arrow straight at it, change the colors, add whatever else you need to sort of make your point within your presentation. I can also mask surrounding areas. So for instance, if I wanted to just look at a couple counties, I get really distracted by all the other things. So I'll often come in and just pick specifically what I want to see and go from there. And then I'll demonstrate the swipe layer later, but we do have a number of footprint tools. And I did want to show our COVID-19 vulnerability footprint. So this was something we made early on when we first learned about, all of us first learned about COVID-19, and everyone was looking at population density, uninsured population, and the population that are 65 and older. And so we took these three ranges and sort of tried to piece them together across the United States. And anything that met all three of these thresholds will show up in dark red, indicating that this might be an area that needs some extra help because they're more susceptible to COVID-19. Or the light red at least meets two of these. So these can also be changed. So if you wanted to see, the same population density, the same uninsured, but areas that have a population age 65 and older, and it's more than 48%. And it looks like a lot of those disappear. But for instance, here is a very tiny dark red. Looks like I picked the wrong one. It's so small. I'm gonna try to get in closer. Yeah, that meets all three of those criteria. So the total population's 4,300. The density is 3,340. 8% of those people are uninsured, and over 50% of those people are over 65 and older. So that might kind of change your decisions on programming, who gets what resources first, things like that. So I know many of you are working on different projects around COVID. You can also create a personalized vulnerability report based on the thresholds you created. So if I were to, change that back to kind of a higher range and then generated my report, you'll see it'll automatically change those that meet those three, and I get all that data in a table to start the conversation from there. As always, you can save these maps, share them, and export them. These can be pulled as image files and go from there. And at any time you need help creating this map, either reach out to us directly or click this help button up here in the top right, and you'll find some support material to help you run through any of the problems you might be facing. But like I mentioned, anytime feel free to reach out. So from the map room, I'm going to go ahead and hop to our COVID-19 resources page and show a little bit more from there. And so, like I mentioned before, outside of the assessments in the map room, because we're a research center and we all just highly value data and social change and everything happening in the world, we're always just responding with new tools and dashboards that we would find really interesting. And we always want to provide them to anyone using our products available at any time. So this is sort of everything we've done since the beginning around COVID-19 as our response. You can see different national dashboards, different cases in the last 14 days, that vulnerability footprint, and then a number of like starter maps that have, you know, ICU beds and hospitals, demographics, different things like that. But what I wanted to specifically show was a couple of things on our national COVID-19 dashboard. These kind of take a second to load, so I'm going to give it just about 10 seconds here. Give this an opportunity to load for a minute. And what this is going to be specifically is the total number of confirmed cases and the total number of deaths, and you can select states from there. But something I wanted to point out were these tabs here at the bottom if you wanted to come in and see some more information. This was a really good example of that swipe layer I was talking about that's also available in the map room. So if you have two different things in your legend and you just want to see the change between them without having to fumble through the checkboxes and things like that, I recommend using this swipe layer. And so you can kind of start to see what exactly is going on between the COVID-19 total confirmed cases and the COVID-19 cases per 100,000 people. And so it looks like the dark blue and the dark red are the ones to be looking out for. And so as you can see, the layers changing. This dark blue actually is light red when you kind of function over it. And then always click on it to find out more. It looks like I just clicked a random one. There's a case rate with confirmed 71,000. And when I hover over to the other side and look at the other end, you'll get the other side of the data. And so we do also have a number of county vulnerability indicators. Like I mentioned before, if there's an indicator in our assessment that you want to see, but you don't have access to it, it might be in another tool, or every indicator within our assessment can be found within the map room free of charge. So always go in there and play around, but you might have to do some extra digging from there. This was sort of a dashboard we collected early on around demographic vulnerability, the different economics, health, and mobility. And what we've done is selecting your state up here in the corner and then your specific county. I'm just going to go ahead and stick with this Alabama. But as you can see, it gives me the total cases, the total population, different things like median age. And like I mentioned, this was huge early on, knowing, we have 55,000 people. And if everyone gets it, we only have 85 beds and only 6 of them are ICU. We're going to need some help. And so this was used heavily early on when allocating resources for staffing, for ICU beds, when respirators were a much bigger deal in the beginning. And then same for the economic vulnerability. What is the broadband usage? Only 28% of this county is even using broadband speeds, and 17% don't even have internet. So if we put out communications through the internet, a handful of our county won't get them. What's the uninsured population, the population in poverty? What are the different outreach methods we're going to need to do based on this data? And then this was the different job sectors we thought it was important to visualize because these might be affected kind of right out the gate. It looks like this county is heavily working in the education space. They were plenty busy over the year, as we know, with kids in schools. But then you could kind of see what else you might see going away. Retail marketing was kind of a big thing that we saw drop right out the gate. And so what was going to happen to this, value coming into that county? The health vulnerability. What's the amount of adults who smoked, high blood pressure, diabetes? This also starts to assess kind of those vulnerable populations like we were talking before. Just another way to visualize the data and kind of start that conversation of, what are we going to do from here? This is what the information is telling us. And then county mobility. So what was the grocery mobility, workplace, residential? It looks like we didn't have any data to pull for these other two sources. All right, well, if there are no questions right now, if you think of anything, feel free to reach out to us. I'm going to go ahead and send a follow-up email to this demonstration containing this video. And then we're also going to include a 20% off coupon code to our subscriptions that will be set up for a week. So if you're thinking, wow, this might end up actually being something that would serve our community and our organization, let's continue the conversation and feel free to use that that code. We've also created a specific blog around COVID-19 that we've put out within the last couple of months that I'll include in there as well. It's a really great read, and it was written by Elisa, who's on this call right now. Shout out to Elisa. And then if anyone else has anything, feel free to reach out to sparkmap@missouri.org. And if not, that's all I had for today. So thank you so much for joining, and hopefully we'll be talking soon.